talk about calcium. These has actually been brought up quite a few times by my patients recently, partly because they are taking calcium supplements, and also partly because they read a lot about high calcium scores and heart scans, and so many people have put two and two together and have asked me, hey, high calcium score means you have heart disease, so is calcium bad for you? So there are some concerns raised whether calcium supplements are responsible for the high calcium or calcifications in the heart arteries. Is that true or is that myth? When we spoke earlier about calcification causing high calcium score in the coronary arteries, we are really talking about deposits of calcium in the atherosclerotic plaques, that's blockages in the artery walls. That's very different from the blood calcium. Blood calcium is the calcium that's floating in the bloodstream, and that can be elevated by your dietary calcium or by the calcium supplement. So the blood calcium is affected by your diet and your calcium supplements that causes your blood calcium to go up. But it's very different, a different entity altogether from the calcifications that is deposited in the arteries, okay? So I think it's important to make that distinction. But would that high calcium in the blood lead to calcification in the arteries, the plaques? That is something that has been controversial because if you look at the literature, there's a lot of conflicting data. There is data from certain groups that have done research on this topic which have shown an association with patients who take calcium supplements and a higher risk of heart disease. So they confer that these patients who take calcium supplements that will lead to a higher incidence of heart disease and possibly by increasing the calcification in the plaques and so forth. But then, equally, there are other studies which have shown the opposite, where taking calcium supplements are not associated with an increased incidence of heart disease. And in fact, there is one particular study which actually showed the opposite, where taking calcium supplements actually has shown a reduction in heart disease. So I think there's a lot of conflict in the literature regarding whether the calcium supplementation actually causes heart disease. What's clear though, from all the data, is that dietary calcium is better than calcium supplements and calcium pills, for example. All the data, if you actually divide and look at the studies which have looked at patients who take natural calcium, meaning calcium-rich foods, dairy products, milk, yogurt, cheese. The calcium from that, if you look at patients who take that and you look at the association with heart disease, there's actually very little evidence. In fact, dietary calcium leads to heart disease. Where the controversy lies is in the calcium supplements, taking the pills. That's where there's some conflict in the data. So if you look at a general consensus at the moment, most of us feel that if you will increase your calcium intake by natural means, meaning taking more dairy products, calcium-rich foods, then it's usually quite safe. The risk of heart disease is actually very low. So just to summarize what I just said, one of the reasons why many people would want to take calcium supplements is to improve their bone health. But there are many ways in which you can do this. Calcium supplementation is only one way. So if you want to cut down your calcium supplementations, there are other ways in which we can strengthen our bones. I would suggest one of the three following ways. One is to consider increasing your exercises, improve your bone health, especially if you increase your weight-bearing exercises. Of course, getting more sunlight exposure, do your exercises outdoors, going for walks in the sunlight, that will enhance your vitamin D levels. And of course, increasing your leafy green intakes, which means taking vegetables which are rich in vitamin K, which also has a role in bone health as well, in improving your bone health. Well, thank you for watching. I hope you liked the video. If you do, please don't forget to like, share, and comment. Thank you.